and talked and presented question number up to question number 44. So, today we are going to move with question number 45. Here you can see question number 45 mentioning which model, and this is set A. We have to keep in mind this is set A. Which model proposes that memory is organized in a network of interconnected nodes? Options are associative model, connectionist model, network model and linkage model, and correct answer is connectionist model. The connectionist model, also known as parallel distributed processing PDP, that proposing memory is organized in a network of interconnected nodes. When we talk about connectionist model, in this model node represent concept or unit of information as well as connections between those between reflect the relationship among these concepts. I am repeating it what I mean to mention. Node represent concept or unit of information and the connections between all of these between concept and unit that reflect relationship among these concepts. So, correct answer will be connectionist model. Question number 46, which disorder involves alternating episode of mania and depression? I don't think कि किसी को problem होगी. We all are aware, right, which disorder is characterized by mania and depression. Our options are bipolar disorder, major depressive disorder, schizophrenia, generalized anxiety disorder. Correct answer is bipolar disorder. As I told you in previous class, if you remember, no matter how much confident you are, how much confidence you are about the answer, suppose that if you are reading this statement, which disorder involves alternating episodes of mania and depression, I know that disorder will be bipolar. First option is bipolar. Do not choose any option before reading all the options given over there, right? So, I am reading bipolar, I know bipolar will be answer, but bipolar, major depressive disorder, schizophrenia, GAD, I am reading all these and then I am evaluating. Yes, still I think bipolar disorder is the right answer. So, I am moving with bipolar. So, A, bipolar disorder is right. Here you can see the biopsychosocial model integrates which of the following factor in understanding mental health. Now, you can see when we talk about a biopsychosocial model, so there are three terms: biological, psychological and social. Biological, psychological, social. So, options are A, biological, psychological and cultural, right. Second, biological, psychological and social, cognitive, social and emotional, genetic, environmental, developmental. So, among all these options, closest one is biological, psychological and social. Question number 48, what is the critical feature? What is the critical feature of Carl Rogers client-centered therapy? When we talk about Carl Rogers client-centered therapy, that is also known as person-centered therapy, that emphasizing the importance of therapeutic relationship, particularly the concept of unconditional positive regard. This simply means that the therapist accept and support the client without judgment and allowing to the client to explore their thoughts, feeling freely and explore their potential and capacity. So, correct answer will be B, therapist providing unconditional positive regard. Question number 49, according to Freud, which term refers to the part of the personality that mediates between desires and social rules? Option A, id, option B, superego, option C, ego, option D, self. And when we talk about this, according to Freud, the ego is the part of personality that mediate between the primal desire of the id and moral standard of superego. We all are aware id works on pleasure principle, superego works on ethical and social principle, and ego basically mediate between these two things, these two concepts, id and superego. So, correct answer will be ego. Option C will be right. Question number 50. What is the concept of neural pruning in neuropsychology? Options are a strengthening of neural pathways, elimination of unused neural connections, growth of new neurons, increase in brain size. And correct answer will be elimination of unused neural connection, because when we talk about neural pruning is connected to elimination of unused neural connection. Neural pruning is a natural process that occurs in the brain where unused or unnecessary neural connections are eliminated, right. So, unused and unnecessary neural connection will be eliminated, and this is natural process, and we call them, as you can see, neural pruning. Question number 51. The tendency of people to attribute their own behavior to external causes and others' behavior to internal causes is referred to as option A, self-serving bias, option B, fundamental attribution error, option C, actor-observer effect, and option D, stereotyping. And correct answer is actor-observer effect. The actor-observer effect refers to the tendency of individuals to attribute their own action to external factor such as situational circumstances, while attributing others' behavior to internal factor such as personality trait. So, correct answer will be auto-observer effect. Question number 52. According to law of fill in the blank, items which are close together in space and time tend to be perceived as belonging together or forming an organized group. So, there are very popular law of perception presented by Gestaltian, right. So, Gestaltian mentioning that we are using certain law principles whenever we perceiving something. So, here you see according to law of which law, in which here you can see items which are close together in a space and time tend to be perceived as belonging together or forming an organized group. Correct answer is proximity. A, proximity, that is nearness. We can take one example of nearness. This is horizontal line or vertical line. You can say this is horizontal line. Okay, fine, you are right. This is horizontal line, right? Again, I am drawing one more horizontal line. You can say yes. Third horizontal line. Okay. Fourth horizontal line. Okay. Fifth horizontal line. Okay. Now, after a specific period of time, you can see now it is really difficult to consider them horizontal line. Now, this is perceived and you are perceiving them as vertical line. And why this happened? Because I presented or मैंने यहाँ जो बनाया line that was horizontal line, right? मैंने यहाँ horizontal line draw किया, but after certain period of time you are observing them as vertical, right? और यहाँ ये हुआ क्यों? Just because proximity. This particular right circle is more closer to this circle in comparison of this. So, we are grouping those objects together that is closer to each other. That is why proximity will be right answer. Data represented in a series of rectangles, each of which represents the scores in one of the class interval of the tabulated distribution is called. Okay. Option A, frequency polygon, option B, bar graph, option C, histogram, option D, pie chart, right? And correct answer will be C, histogram. Histogram is a graphical representation of the distribution of numerical data, where data is grouped into ranges or bins, right? And each range is represented by a rectangle. So, here in this particular case, histogram will be right answer. Histogram will be right. Next, the tendency of the rater, interviewer, to judge an individual on the basis of one single attribute is referred to as option A, similarity error, B, central tendency error, C, contrast error, and D, halo error. Correct answer will be D, halo error. Just because halo error simply means when you are identifying one specific characteristics of a person and your judgment will be based on those characteristics. That means if you are observing one characteristics that is positive, you think that other characteristics that individual having that also will be positive. So if one positive characteristics is visible, you are associating that this individual also having other positive characteristics, and if you are identifying certain negative characteristics, we are assuming that other characteristics will also be negative in this individual, that is halo effect. So halo effect occurs when an interviewer or rater evaluate an individual based on single characteristics or attribute, right, and we can say that impacting their overall judgment. So they are observing or they observed one single characteristics that might be positive, that might be negative, but their overall judgment about that particular person will be impacted. This is halo error. Here you can see Jean Charcot demonstrated that hysterical phenomena such as loss of feeling in limbs or fainting could be produced by option A, hypnosis, option B, suggestion, option C, both A and B, and D, relaxation. And correct answer is C, both A and B, both A and B. Why? Because when we talk about Jean Charcot, they demonstrated that hysterical phenomena such as loss of feeling in limbs or fainting could be produced through both hypnosis and suggestion. Charcot worked at the Salpêtrière Hospital. This is the name of hospital, Salpêtrière. So Charcot work at the Salpêtrière Hospital in Paris involves using hypnosis, right? Hypnosis, they used hypnosis to induce symptom in patient, that highlighting the role of psychological factor in hysterical condition. So overall, we can say whenever we are discussing about contribution of Jean Charcot, we can say hypnosis and suggestion. According to them, hypnosis and suggestions both will be responsible for it. So C, both A and B will be right. Here you can see Barbara Fredrickson is known for her work on cognitive distortions, flow theory, broaden and build theory, and psychodynamic theory. I don't think you will face much difficulty to answer this. Correct answer will be broaden and build theory, because Barbara Fredrickson is renowned and they are known, right, for broaden and build theory. Whenever we are thinking about Barbara Fredrickson, we think broaden and build theory, right. So they presented this particular theory of positive emotion, that simply suggesting that positive emotion expand cognitive process and behavioral responses, and that leading to the development of personal resources over time, right. So whenever we are talking about Barbara Fredrickson, so one theory that we are recalling, जो हमें याद आता है, that is broaden and build theory, because this particular theory right made Barbara Fredrickson so popular. So correct answer will be broaden and build theory. The bystander effect suggests that option A, people are more likely to help when they are alone than in a group. People are more likely to help when they are in a group than when alone. Bystanders are more likely to intervene if they see others not helping. Bystanders are less likely to notice emergencies in group, and correct answer will be A. People are more likely to help when they are alone than in a group. We all are aware what is bystander effect. The bystander effect refers to a phenomena where individuals are less likely to offer help to a victim when they are in group or other individual is presented. Because sometime what happen, when individual is in group or is at a certain place, when other individual is also observing that event or observing that emergency, individual thinks this is not my responsibility now, because there are so many individual, यहाँ बहुत सारे लोग हैं, every individual is aware about this accident, this emergency, so किसी ने तो किसी ने फ़ोन कर ही दिया होगा, and this is not my responsibility now. So this sense, right, creating problem for those individual who is in emergency situation, we call them bystander effect. So option A will be correct. People are more likely to help when they are alone than in a group. Question number 58. Julian Rotter's concept of locus of control describes whether individuals believe that their outcomes are controlled by. And here you can see options: external forces or internal efforts, their cognitive schema, genetic predisposition, social status, and correct answer will be external forces or internal efforts. Here you can see Julian Rotter's concept of locus of control describes whether individuals believe that their outcomes are controlled by, that will be external forces or internal effort. Julian Rotter concept of locus of control simply referring to the degree to which individual believe that they can control the outcome of event in their life, right? If you want to understand more about locus of control, so I already made a video on locus of control. You can refer that particular video. If you are having any doubt, any query, you can mention, we can discuss on them. So locus of control is a concept that we are finding in existential psychology. So that is very important, right? And when we offering therapy that is based on existential approach, this locus of control playing very important role in that. Moving ahead. Here you can see which neurotransmitter is primarily involved in muscles contraction and is also linked to learning and memory. Options are dopamine, serotonin, acetylcholine, and glutamate. One thing, whenever we are answering questions related to neurotransmitter, it is really very challenging to mention that only this neurotransmitter is responsible for learning, because we all are aware there are multiple neurotransmitters who can be involved in learning and memory. How any individual can say that dopamine is not responsible for learning memory, serotonin is not, acetylcholine is not, and glutamate is not? All these neurotransmitters is responsible, somewhere responsible for learning and memory. But we have to answer these kind of questions based on, right, more supportive evidence कि इसमें कौन सा ऐसा neurotransmitter है जो इस statement को ज़्यादा support करता है, right? So with this particular sense, we can say we can choose acetylcholine. So acetylcholine is a neurotransmitter that play critical role in muscles contraction by transmitting signal from motor neuron to muscles. This is the one specific function. Here you can see we also need to mention the correct answer on the basis of muscles contraction. Here you can see learning and here you can see memory, right? So when we talk about acetylcholine largely involved in muscles contraction as well as learning and memory. So additionally, I would like to mention that it is involved in various cognitive processes, including as I told you, muscles contraction, as well as learning and memory, particularly in area like hippocampus. So if hippocampus area will be stimulated just because of acetylcholine, so they play role related to memory, related to learning, and acetylcholine is also strongly connected to muscles contraction, so we can choose acetylcholine as correct one. But as I told you in the beginning, whenever we are answering question related to neurotransmitter, related to brain organs, it is really challenging and difficult to say, okay, there are no any evidences and there are no any studies who are supporting other neurotransmitters or other brain organs. There will be, and there are so many evidences who are explaining that different, like dopamine also responsible for learning and memory, and dopamine is also responsible for motor activity. We all are aware of it. When we talk about serotonin playing important role in learning, we cannot deny it. But when we talk about acetylcholine, there are more evidences that acetylcholine primarily involved in muscles contraction as well as learning and memory. So acetylcholine is more closer in comparison of other options. That's why acetylcholine will be right answer. Which research design is best suited for determining cause and effect relationship? Interesting, and you are having these options: correlational study, cross-sectional study, experimental design, and case study. In psychology, there are few specific research design that we are using and we are giving priority to them, like correlational research design, descriptive research design, experimental research design. So cross-sectional study, case study, this could be the type of descriptive research design, and we all are aware whenever we are using correlational study telling us the relationship between two and more than two variables, they are not explaining us causal effect, cause and their effect. Whenever we are trying to understand cause and effect kind of relationship, in those particular situations, experimental design will be more important. So correct answer will be experimental design. Which branch of psychology is concerned with optimizing human behavior in workplace? Options are counseling psychology, industrial organizational psychology, forensic psychology, developmental psychology. Now here you can see which branch of psychology is concerned with optimizing human behavior in workplace. Whenever we are talking about workplace, and similar things at job, so we can say that will be the subject matter of industrial organizational psychology. So correct answer is B, industrial organizational psychology. A person is most likely to experience cognitive dissonance when? Here you can see option A mentioning their thoughts aligned with their behavior. Option B, they are forced to make a decision that goes against their beliefs. Option C mentioning they are praised for completing a task, and option D mentioning they recall positive memory. हमने कल ही डिस्कस किया है what is the concept, what is the meaning of cognitive dissonance. हमने कल डिस्कस किया था cognitive dissonance means when any individual having contradictory behavior and attitude or belief. So if any individual's belief and behavior is contradictory, in those particular situation individual face this cognitive dissonance. Here when we talk about this statement, correct answer will be they are forced to make a decision that goes against their belief. Here you can see the statement, a person is most likely to experience cognitive dissonance when? Option B, they are forced to make a decision that goes against their belief. So if I am having any belief, I am strongly believing something, but if other individual, maybe who are in authority, maybe family member, maybe friends, force me to behave in a such way or make decision in a such way that is against my belief, we can say that will be cognitive dissonance, and there will be cognitive dissonance individual feel those dissonance. So correct answer will be B. They are forced to make a decision that goes against their belief. 63. Which neuropsychological disorder is characterized by severe memory impairment and confusion, often caused by chronic alcohol abuse? Option A is schizophrenia, option B Korsakoff syndrome, option C Huntington disease, and option D multiple sclerosis. And correct answer will be Korsakoff syndrome. B is the right answer. A statement mentioning which neuropsychological disorder is characterized by severe memory impairment and confusion, often caused by chronic alcohol abuse. Korsakoff's syndrome is a neuropsychological disorder that characterized, right? Mainly we are finding severe memory impairment and confusion, and primarily due to chronic alcohol abuse and resultant thiamine, right, means vitamin B1 deficiency. So according to the options that we are having, schizophrenia, Huntington disease, multiple sclerosis, and what kind of symptom they are mentioning, like memory impairment, confusion, and all these problems just because of alcohol abuse. If we are combining memory impairment, confusion just because of alcohol abuse, so most probable answer will be Korsakoff's syndrome. Fine? Okay. In Erikson's theory, which conflict characterizes in late adulthood? Option A, autonomy versus shame, integrity versus disappear, initiative versus guilt, and generativity versus stagnation, right? So if we are looking for these, correct answer will be integrity versus disappear. Integrity versus disappear. Why I am mentioning it? Because whenever we are talking about late adulthood, if individual is in late adulthood, they are reflecting on their life, what they did in the past. If they think I achieved something that is unique, my life was useful, successful, I did something that contributed to my family, society, nation, right, and my achievement is unique, in those particular situations they will develop integrity rather than they will develop disappearance, right. Correct answer is B, integrity versus disappear. Next, what is the main difference between classical and operant conditioning, right? We all are aware what is classical conditioning and what is operant conditioning. Here you can see options. Classical conditioning relies on reinforcement, operant conditioning does not. Okay. B mentioning classical conditioning pairs two stimuli, operant conditioning rely on reinforcement and punishment. Okay. Operant conditioning involves cognitive processes, classical conditioning does not. Okay. And D mentioning both are entirely different learning processes. Correct answer is B, because here you can see in option B, classical conditioning representing, right, or classical conditioning pairing two stimulus. That is correct, because we are combining unconditioned stimulus to conditioned stimulus. So this is correct. This statement is correct for the classical conditioning. And operant conditioning relies on reinforcement and punishment. So reinforcement, reward, punishment we are using in operant conditioning. So this statement is true. In classical conditioning we are pairing two stimuli, and in operant conditioning we are using reinforcement, punishment or reward to teach, to make learn something, right, to help individual learn. So B will be the right answer. 66. Generalized anxiety disorder GAD is a pervasive condition in which the sufferer experiences. Options are continued apprehension about unspecified things, B fear of fear, C continual flashbacks to past events, D a desire to check that the environment is safe. And correct answer will be continued apprehension about unspecified things. GAD is a pervasive condition in which the sufferer experience continued apprehension about unspecified things, like they will be worried about their job, their education, right? Children's education maybe, their health, right? So this is a kind of continued apprehension about unspecified thing, like individual will take concern, extreme concern about their financial loss. But why financial loss will be there in the future? What kind of activity you are performing, and why do you think there will be financial loss in the future? Individual will not be able to mention those. Individual will be concerned about maybe health, maybe their family, but they will not be able to mention about a specific thing. So there will be continued apprehension about unspecified thing. Correct answer is A. Difficulty in seeing object at a distance is called, your options are myopia, hypermetropia, astigmatism, and D, visual field defect. Myopia, right? Myopia is the right answer, because difficulty in seeing object at a distance is called myopia. Myopia will be the right answer. 68. Consciously faking illness or symptoms of disability to achieve some specific non-medical objective is option A, malingering, option B, altered identities, option C, false identification, and option D, confabulation. And correct answer is A, malingering, right? A is right one. A is right, because this particular point, malingering, right, referring to the intentional fabrication or exaggeration of illness or symptom, right? So this is the only point that we can connect to all these things that given in a statement. So A will be right. In dissociative identity disorder, the identity that is frequently encountered carrying the person's real name is option A, alter identity, option B, host identity, option C, ghost identity, and option D, mixed identity, and correct answer is host identity. In dissociative identity disorder, we all are aware dissociative identity disorder is, the host identity is the primary identity that carries the person's real name and is often the identity that interact most with the outside world, right? So we can say host identity will be right answer, host identity. That's all for today, right? बाकी जो questions हैं, means approx 30 questions we are having. We will discuss all those questions in next live, most probably tomorrow or day after tomorrow. We will talk live. Now, if you are having any doubt, you can mention in chat box. I am trying to take your doubt if you are having. I am just trying to open your doubt if I will be able to access them. Okay, so Anjali mentioning, sir, in the previous video you said that the cutoff would be approximately 90 plus minus, I think 90 plus minus 2%. This time, ये आपने कैसे guess किया? Please tell. So Anjali, in previous live, I told you one individual, right, mentioned, और एक किसी ने पूछा था कि what do you think, sir, cutoff कितना आएगा? So I said 90 plus minus 2 और cutoff 92 है IHBAS का, right? So I tell that particular number. मैंने वो number इसलिए बताया कि whenever we are conducting test in classroom setting and whenever any students giving us feedback, because we are having so many students, और जो भी students exam दे के आते हैं, we are taking their feedback. So on the basis of feedback, those feedback, we are getting the idea कि कितना आएगा, right? And one more thing is there, जो previous exam है उसका कट ऑफ कितना था और ये एग्जाम जो अभी हुआ उसकी कॉम्प्लेक्सिटी क्या थी, लाइक डिफिकल्टी लेवल ऑफ द क्वेश्चंस, राइट, वो ज़्यादा है या कम है. अगर कम है so accordingly cutoff will go up, अगर difficulties level ज़्यादा है so cutoff relatively will go down. So उसके basis पे we are analyzing कितना बढ़ सकता है. So on the basis of that we realizes कि cutoff 90 के आसपास रहेगा, so 90 plus minus 2, that's why I told at that time. Okay, so hello Needman, right? Needman vlogger. Hello Needman. Siddhi mentioning, sir, we can't see the questions. Okay, I think I fix it. Anjali mentioning regularly live. Yes, sir, please. Anjali, I really wanted to be live, but what happened? Whenever I'm coming live, maybe right, I'm not coming live. That's why, maybe I don't know why, but we are not getting so many queries. Whenever I am coming live na, I need right food from the viewer, right? So when I am coming back, I am expecting that individual will ask so many queries. When they are asking queries, I am developing sense कि हाँ उसको need है. Maybe if I am coming live, they are getting benefit. Whenever I am not getting comment, मुझे लगता है कि maybe right this kind of live is not helping individual. That's why sometime I am pulling right my those initiative back and हम लाइव नहीं आते, कभी कभी बहुत ज़्यादा टाइम हो जाता है लाइव आए. Siddhi mentioning some people are answering the questions before it's being discussed or revealed. Don't cheat, guys. Okay, interesting. सर फर्स्ट पार्ट कब आएगा रिगिंग वाला? फर्स्ट पार्ट तो हमने ऑलरेडी कर लिया, राइट? जो फर्स्ट पार्ट था उसमें हमने आई थिंक 30 क्वेश्चंस हमने डिस्कस कर लिए थे ऑलरेडी. सो इफ़ यू डोंट हैव दैट लिंक, सो मैं अपनी टीम से बात करता हूँ इफ़ दैट इज़ नॉट अवेलेबल, क्योंकि फर्स्ट क्लास में ना थोड़ी टेक्निकल कुछ प्रॉब्लम थी, राइट? दे टोल्ड मी कि कुछ टेक्निकल प्रॉब्लम राइट है उस वीडियो में. So if I find that particular video online, so we will try to make them live. Siddhi mentioning, sir, please do come live more frequently if possible with some more model questions. Okay, Siddhi, thank you for mentioning your suggestion. Anjali mentioning thank you. Okay, Anjali, welcome. So that's all for today. See you in next live. Bye. Take care.